HCC coding. If you've not heard of it before, you might be wondering, what is an HCC code? Is it something different? Do I need a new book to learn this? How does one become an HCC coder? Let me tell you today some of the basics of HCC coding and where you can get trained and get more information and actually get certified as an HCC coder. Hey everyone, I'm Victoria Moll. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. If you haven't already and you need more medical coding content, would really appreciate it if you subscribe and hit that notification bell so that you can get alerts when I post new episodes. So what is HCC? HCC stands for Hierarchical Condition Category, and they're basically just groups of diagnosis codes. Let's talk specifically about CMS HCCs, the Center for Medicare and Medicaid Services HCCs. So they've identified groups of diagnosis codes that have a similar sort of cost, similar severity, and grouped them together in an HCC. So out of the 10,000 or so ICD-10-CM codes that we utilize, there's only a small portion of them that have an HCC. You can often identify these in your ICD-10-CM manual because a lot of them now have a little icon that says HCC next to the ICD-10-CM codes that are grouped in an HCC. So the CMS HCCs are a list that you can download on the CMS website, and it will tell you all of the HCCs and the associated ICD-10-CM codes that they have identified as being more severe and more costly, and they group together the ones that they feel are similar into an HCC. So Medicare will pay the Medicare Advantage plans that have patients enrolled with these diagnosis codes a little bit more for reporting out through their claims data and other processes that they have these certain diagnoses, and they need to report them out once a year. There's also some commercial insurances that providers contract with that can include things like bonus payments based off of hitting certain quality measures, and HCCs do play a factor into those. It pretty much plays into our overall goals in healthcare, which is taking patients that we know have more severe diagnoses, more conditions that we should be paying attention to and managing, identifying those, managing them really well, getting them on the right treatment plans, and doing things like keeping their costs down, keeping them from being admitted to the hospital because they've got an exacerbation or because something happened. So what does an HCC coder do? Well, there's a variety of places where HCC coders work now. A lot of them do project-based work. So working with these Medicare Advantage plans and taking either, one chart and verifying or validating the HCCs and diagnoses on that chart, or they could get a whole year of the patient's charts and medical records to review and validate certain HCCs that were reported. So they're reviewing these records for opportunities or discrepancies, even things like if a PCP documents that a patient has E11.9, uncomplicated diabetes mellitus, but they look at the record and go, this patient's also seeing a nephrologist for some kidney problems. Maybe they have diabetic nephropathy, which has a higher severity, higher HCC, and is paid at a higher level. And looking at that and going, maybe there's some opportunities here for provider education, or just notating that there's these discrepancies. So there's a ton of HCC positions for insurances and vendors, but then now we're also starting to see them on the provider or healthcare organization end, where I've seen quite a few healthcare organizations that are getting teams together of coders just to review for diagnosis codes and for HCCs so that they can get those better bonus payments from these quality program contracts that they have. Not to mention, these providers are contracted with the Advantage plans, and if the Advantage plans are getting more money from Medicare, then they'll have more money to contract with for the providers, right? So what certification do you need to become an HCC coder? Well, most positions now are looking for the CRC Credential, which is the Certified Risk Adjustment Coder. We often refer to HCC coding as risk adjustment, so you'll see that referred to as risk adjustment a lot. And that's the credential that you would need. Not to say that they might not hire you just with a CPC. There's some positions where they very well might, but there is quite an uptick in the requirement for the CRC Credential. Now, you do not need to be a CPC in order to get your CRC. There's actually no requirement for any of the AAPC credentials that you have to get them in any sort of order or have a base credential before you get a specialty credential. Just understand, if you only have your CRC, that means you can only apply for risk adjustment in HCC positions. You won't be able to apply for professional coding, outpatient coding, inpatient coding. That's not to say that you can't start with your CRC and then go back and get your CPC or your COC. You absolutely can do that. And risk adjustment coders do make a pretty decent salary. According to the most recent AAPC salary survey, their CRC credentialed coders usually get about $62,000 a year. Now that's a general poll of over 10,000 AAPC members, so it may be very different for you in your area if you're working in person, remote, if you have no experience versus 10 years of experience. So what are the advantages of being an HCC coder? Well, you only have one code set to work with, and that's ICD-10-CM, although you do have to have an absolute mastery of ICD-10-CM, not just looking up codes, but really understanding the guidelines as well as the coding clinic. If you're not familiar with what is the coding clinic, you can watch this video here, and it will tell you all you need to know about the coding clinic, but essentially it is official guidance published by the American Hospital Association on ICD-10-CM, clinical cases, scenarios, and official guidance on how you use them in certain cases. Also, even if you're just doing pro-fee coding, it is so incredibly crucial to understand how these diagnosis codes can feed into their provider payments for these quality payment programs and for these commercial bonuses that they have through their quality programs. Because the better the providers are at really documenting the appropriate specificity, not using words like history of, which in coding means that they don't have it anymore, and feeding those HCC scores to make sure that we're selecting the right code, reporting it out to insurance, that's going to really maximize their reimbursement. So it's important for all coders to really understand how that feeds into the whole process. If you're interested in getting your CRC, I actually have a couple of different options. First, I have a full course, the full shebang of CRC. We'll start with intro to health information, a little bit of med term, then ICD-10-CM, and then really get in depth about the different risk adjustment programs, the quality measures, the STARS, HEDIS, how that plays into everything, and then really the frequently coded conditions in risk adjustment and focus on those. I also have boot camps that are for people who have had training in ICD-10-CM before they know about medical insurance, so we kind of skip that part and really get into the deep dive of just risk adjustment specifically for the CRC credential. And then I also have a review class. So if you're someone who just wants to self-study, but you need a practice examination, you need some review, you can purchase that on my website as well. That's a pretty cheap product. I have it at $29.99 currently. And it has a 50-question practice exam, and it's just a 3-hour condensed prep right before you sit for your CRC exam. And this really is focused towards the credential because there are different thought processes, different methodologies that certain insurances or contracts may take certain types of documentation, like from a problem list, and interpret it a different way than others. So this is going to tell you exactly what it is that they're going to test you on for the certification exam. Now, there's other great programs out there that you can take if you just want to learn everything there is about risk adjustment, but mine specifically is geared towards the certification planning. Also, the best book on the market, hands down, that you can get for risk adjustment is Risk Adjustment Documentation and Coding by Sherry Poe Bernard. It is a fantastic resource. I'll link the Amazon link below. So HCC coding really is just working with ICD-10-CM codes on different projects or scopes, or with, CMS and they have these RADV audits, risk adjustment data validation audits, knowing about those. It's great for new coders because you're only working on one code set, which is great. Oftentimes these places that are hiring for risk adjustment coders hire 50 to 100 people at a time to work on this long-term project. So it is a really great opportunity for medical coders, but you do have to have a really expert understanding of ICD-10-CM. If you found this video helpful, really appreciate it if you give it a big thumbs up. I will see you guys in the next video, and until then, just keep on coding on.